Hi everyone, welcome to my Capstone presentation. My name is Wendy Weum and I am a Group Hospital Service Administrator for DaVita Kidney Care's Acute Hospital Service line of business. I'm here to discuss the exciting project I have that encompasses a collaboration between St. Francis Hospital and the DaVita Kidney Care Group. The project will focus on a subset of dialysis patients that have been identified as frequent readmissions into St. Francis Hospital. These rehospitalizations are falling within the 30-day time frame that is creating a financial issue with regards to reimbursement at St. Francis. Due to the Affordable Care Act and Medicare's hospital readmission program, any hospitalization within 30 days from discharge due to the same diagnosis is not reimbursable. In order to be good financial stewards, DaVita began identifying this prior to the hospital even realizing this was a problem. As the patients arrive in the ED department, they are symptomatic of CHF, congestive heart failure, due to fluid overload. It can be hours or even days before nephrology is brought in to assess. Nephrology immediately orders a treatment and the false CHF system subsides. This admission could have been completely avoided had nephrology been made aware and consulted prior to admission. Some patients, unfortunately, due to home life, prefer to be hospitalized versus traveling to their outpatient units. I feel proper education will hopefully help encourage compliance for these patients with regards to attending outpatient chronic treatments. This is why I propose the following project and look forward to being the consultant on this very important initiative. Rates of readmission have been a national problem, and the outcomes of this pilot could lead to changes at a national level with regards to educating and changing behaviors in this subset of patients. These patients are non-compliant, meaning that they are not following their physician-prescribed orders or going to outpatient dialysis 3 times weekly. Without dialysis, renal failure sets in as toxins build up in the body. A buildup of toxic fluids can make it more difficult to breathe and can even lead to cardiac failure and even death. Patients miss treatments for various reasons, whether it's illness, not wanting to spend time at treatment, psychological issues, psychosocial issues, they think they feel good, so why go? They may not have appropriate transportation, there's financial reasons, but no matter the reason, they're risking their health. Patient education and/or individualized attention, supervision, encouragement, and support are widely advocated strategies to improve patient compliance. As consultant to this project, I have identified core team members that will help define, analyze, implement, deliver, and follow up with regards to our plan. The members include myself, Wendy Weum, as consultant/project manager. I have been with the DaVita Hospital Services Group Administrator, and I've been in this role for about 5 years, giving me the knowledge and skill set required to lead this plan. Additionally, we have executive leaders from St. Francis, managers from both the emergency room department and the CHF unit, and a lead physician and EPIC team support as well. Each member of our core team has valuable skill sets required to deliver, implement, and follow through on this project. As consultant, it will be my job to ensure we build strong relationships across our various business units, and furthermore, make sure we have a set communication plan that will deliver on-time updates to all stakeholders involved. Our primary stakeholders include first and foremost our patients. They're the real reason behind this initiative. While St. Francis may be losing financial reimbursement, even of higher importance is the health consequences of these patients as they continuously miss dialysis treatments. An adaptive leadership approach will be required as we need to focus on behaviors as well across the board. We need to be able to change the behaviors of the patients to convince them of the importance of following the doctor's prescription. We also need to change the behaviors of the hospital, as typically they have just readmitted these patients instead of getting them to dialysis. And we need to better encourage our DaVita team to be patient advocates and partner better with the nephrology team and the emergency room department staff. In looking at our SWOT analysis, we can see that it highlights the fact that DaVita has strong clinical outcomes with regards to dialysis treatments within this hospital setting. We additionally have had a very strong partnership over the past 17 years that we have been contracted with them. Our opportunities are to change the process of the past. Our first step has been to identify these 11 patients who tend to be non-compliant. We propose that these 11 patients have an identifier built into Epic so that the ED is aware when they are readmitted and that they immediately notify nephrology upon arrival. Nephrology will assess patients, get them to dialysis treatments timely. We ask the hospital at this time not to admit these patients, but rather yet, if they're stable, send them to the procedure first. After their dialysis procedure, they will then be sent to a CHF holding area to prepare for discharge. This will allow the hospital to further educate the patients, allow the patients to be discharged, allow the hospital to bill for a procedure which is reimbursable under their outpatient license, and reduce the readmission. This plan will work provided the ET follows the new process, the Epic banner notifier actually works, and nephrology promptly assesses the patients, and we work on the patient re-education. This can be impactful to help prevent further non-compliance. As demonstrated in the PDSA cycle, we're targeting 3 areas of focus: identifying the patients, which is our analysis, working with a technology change, which is the Epic build and doing the identifier, and lastly, the change in behaviors by educating our patients and our hospitals on the steps we can do to prevent the readmissions. Outcomes will be measured throughout the process to ensure that we are reaching targeted goals of readmission of this patient subset by 50% in a 12-month time frame. We will monitor mitigation barriers and make changes to the process as needed. Overall, this is such a win-win for all stakeholders involved. The impact of this change initiative will be measured by the change in the hospital readmissions of the specific subset of these patients. The plan will rely on the connections already established between St. Francis Hospital and the contracted services of DaVita. We will know we have succeeded when our plan is adopted not by just this hospital system, but by the dialysis healthcare community as a whole. As we target best practices, we will identify the successes and challenges of the program. We will also continuously evolve with the changing healthcare landscape. The possibilities are truly endless with this plan, and I am so excited to see how we can change our patients' futures. Thank you so much for taking time to listen to my presentation.